And I've been going to Skin and Vein Center for several years now. I've had a couple procedures done. I've had Axillis on my face and eyes. I've had Restylane on my lips and a little bit of Xeomin in my forehead. So I'm here to learn what else we can do, and I enjoy everybody here and appreciate all the staff and Dr. Dohner.
Hi there, I'm Vivian. I'm here in You Seminar. I'm here for fun. I have had some Botox done. I've had Juvederm. Dr. Dohner is excellent.
Hi there, my name is and I am here with the You Seminar. I do receive Botox from Dr. Dohner. I am amazed by it and would love to learn more of the techniques that we have to body sculpting and just learn more tonight. Thank you.
Hi, I'm Keratosis. I'm new to the area and I was very intrigued and wanted to find out more.
Okay, that's what I think.
That's why I'm here tonight.
Hi, my name is I'm a laser nurse for New York City. I've been here for 8 years. We have all kinds of lasers. We can laser hair, laser spots, red spots, brown spots, leg veins, chemical peels, laser peels. You name it, we can pretty much take it.
Everybody comes to me and says, Dr. Dohner, isn't it vain to want to look better, look younger? Okay, why don't we just all grow old gracefully? Well, and I say, do you brush your teeth? Do you paint your house? Do you go to the dentist? It's maintenance, okay? Nobody wants to look older than they feel. Nobody wants to look older than they actually are, okay? And nowadays, we have things to offer which are just so quick, easy, very safe, just no real downtime whatsoever. So if you go to the dentist to get your teeth cleaned and looking nice and pearly white, come and see us and we can help you, okay? So what is new in cosmetics? This is a slide from about 15 years ago. Well, I can say everything is new. When I first started at Oneonta Laserderm, which has changed the name to New York Skin and Vein Center, we had Botox, we had beef collagen that lasted for 3 months for a filler, and we had 2 lasers that actually did anything. So in the time period, we've had an explosion of things that we can offer you: wrinkle relaxers, wrinkle fillers, treatments for your complexion, lasers, fat dissolvers. It's just amazing. It's very difficult to keep up with. I couldn't even tell you how many lasers, intense pulse light machines, radio frequency machines out there. I mean, if I had to guess, I'd say it's probably 300. So first, before we start talking about natural good looks and how to maintain them, let's look at some natural good looks, okay? So this is my middle daughter, Hope, who will be 19 soon, and this is at her prom. And if you look at her, some of the things that are interesting is her complexion is very clear. Of course, she has a few pimples. But the light reflects off of her face, okay? She has very nice full cheeks, very nice full temples, gorgeous lips. We call them the nasolabial folds here, very nice sharp jawline. And she has the V of beauty. So she has a very nice V on her jawline, okay? So that means she has very nice cheeks coming down to the point of her chin. Here's my second youngest daughter, Claire, who is now in Denmark. She was modeling off a birch bark dress. And you have the very same thing. The very nice V of beauty, the jawline, the cheeks, the temples, the lips, and her complexion is clear. Of course, she's full of makeup here. But her complexion is nice and clear, so light reflects off of her face. And here's Claire again with my youngest daughter. And look at them. Look at the V, look at the V, look at the lights. Look at the light reflecting, okay? This is the way it's supposed to be. So what causes the signs of aging in skin? Now, just as an aside, do you know what the most important anti-aging agent of all time is? Nope. Hair dye. It's the thing that makes you look the youngest. Okay? So what are the two most important factors in facial aging? Okay, sun and smoking. Okay? So stop smoking. So, what are the 3 signs of aging in your face? Okay, because that's primarily what we're going to talk about tonight. All right. Number 1 is complexion. The changes in your complexion. This is the most important thing of all 3. Okay, studies have shown if you work on your complexion, that gives you your biggest bang for your buck. It makes you look the best. It makes you look the youngest. It makes you look the most refreshed. So, changes that go on include age and sunspots and brown spots, veins on your face, sun damage, large pores, acne and acne scars, and textural changes. And we're going to go through more of this as time goes on. Second thing are wrinkles. Guess what? There's 2 kinds of wrinkles. There's the kind of wrinkles when you frown, lift, or smile. And then there's the kind of wrinkle from loss of volume. So we lose volume, we lose volume, we lose volume, we lose volume. Okay? And the third part of aging is sagging or gravity. So let's talk about your complexion and some of the issues that go on with complexion, okay? So some of the things that go on are browns. I just call them browns, okay? What's the color? So freckles, sunspots, uneven skin tones, melasma. And so many women say to me, I've had freckles since I was a kid. I said, well, it's fine when you're 13 to have freckles. It's not fine when you're 56 to have freckles anymore, okay? Reds, broken capillaries, especially on the nose or cheeks, rosacea, angiomas, poikiloderma, and I'll show you examples of that in a minute. And then there's raised spots. We have AKs, which are actinic keratoses, seborrheic keratoses, Mila, and I'll show you more of those. Of course, large pores, everybody knows what they look like. Unwanted hair. And when you pluck hair, guess what? You cause inflammation and color changes on the skin. Acne and pimples, whiteheads, blackheads, scars, of course, acne, chickenpox, trauma, and don't forget your neck and your hands. So here's some common complexions. Here are browns. And this is a before and after. Somebody who's had some peels and some medical grade home care to help take care of her skin. Look at the difference. Has she had any fillers, facelifts, Botox, anything? No. But look how much more youthful, how the light reflects off of her cheeks than it did before. All right? So it's just one example of how important complexion is. Here's somebody else. Guess what? I've had freckles since I was 13. Well, they look good then. They don't look good now. Look how much clearer she looks without those freckles. Here's another example. This woman has great cheeks, little hollowing of her temples, fairly good lips except for the lipstick lines, great jawline here, but look at the color of the skin. If we just cleared up her complexion, she would easily look 10 or 15 years younger. This is an example of melasma. I see a lot of women with melasma called the mask of pregnancy. Your hormones, either being pregnant, being on the birth control pill, some change of life issues, cause the melanocytes or pigment cells to go crazy. This is typically more common in women with more darker skin, ethnic skin, but I've seen it in very fair females as well. And you have to treat melasma very carefully. And you're going to have melasma the rest of your life, but it can be controlled, okay? And if you use the wrong kind of treatment, the wrong kind of laser intense pulse light machine, guess what? You're going to make it a lot worse. Here's some reds. Look at these cheeks. Look at the nose, okay? Makes you look like a boozer, but even though you're not, although all of you are. Here's an angioma. Okay, we treat a lot of these right below the eye, obviously, and it draws your eye to this, and it's distracting. And these are easily lasered. Here's a man with lots of blood vessels on his face. This is called poikiloderma that I alluded to earlier. This is not a rash. We see a lot of patients get sent to us. My doctor says I have a rash. It's not a rash. These are blood vessels from sun damage. Look at this. Why is this clear? because it's under the neck, okay? It's under the chin, so it didn't get the sun. So all of these things make you look older. They make you have to wear heavy pancake makeup, okay? They're distracting to the eye. They prevent light from being reflected. So this is why complexion is so important. Here's some more complexion problems. Thank goodness none of you have this, okay? These are all benign spots called seborrheic keratoses. But I'm going to tell you, we take care of a lot of people, men and women, who have these all over their body. They're benign. They don't have any cancerous potential, thank goodness. But we have people who have hundreds and hundreds and hundreds of these. That they come in, we laser them, they come back in 6 months, we do more. All right, so they can be maintained. Here are two of the same thing. They look kind of warty. Here's a mole. If you're a guy, you'd be cutting this thing all the time. All right, look at this. So here's somebody who plucks the hair. So they have developed what's called post-inflammatory hyperpigmentation at the site of the hair plucking. All right, this is why plucking is so bad. Not only did it change color, but it's causing textural changes in the skin. All right, and we can help you with that. Now here's something that's really serious. These are called actinic keratoses. These are precancerous. They're very common in people who are fair, have English, Irish, Scottish background, but we see them in most other white ethnicities. And these are precancerous. 1 in 100 turns into skin cancer. Thankfully not melanomas, but basal cell and squamous cell cancers. And so that's why it's important to treat actinic keratoses. And when we see them, we make that part of the treatment regimen for someone. And this is a true medical problem. Here are more actinic keratoses. Many people say, I just have dry skin. Guess what? It's not dry skin. These are on here for months and months and months and months and months. They can get better, they can get worse, but there's lots of ways to do it. Now, I'm sure none of you do this. No? Okay, good. Acne. These are called Mila. Think of them as very hard whiteheads, frequently around the eyes. They're tough for you to take care of at home. You're only going to make yourself bleed, okay? So you need to see us for this kind of thing. We can extract them and help you with it. Acne scars. Another thing that's distracting to the eye, okay? And of course, don't forget your hands. And don't forget your chest, all right? Because if you have a beautiful, gorgeous, youthful face and your neck looks and your décolleté looks and your hands make you look 20 years older, what good have you done for yourself, okay? So let's talk about wrinkles. So we talked about complexion, what's on the surface. Now we're going to talk a little bit about wrinkles, okay? Remember, there's two kinds of wrinkles, the kind when you frown, lift, or smile, and then there's the kind from loss of volume, okay? So how do we lose volume? We lose collagen, we lose fat, we lose muscle, we lose teeth, we lose bone, all right? Grrr. All right? These are called glabellar lines, or the 11s, or frown lines, or squint lines. This is a wolf nose on a woman, it's a bunny nose on a man, okay? Guess what? You squint a lot, you concentrate a lot, these lines get etched in. They make you look tired. They make you look angry. They make you look like you're not having a good time when all you're doing is thinking, okay? Here's forehead lines. Of course, these are very distracting, especially if you have a high forehead, okay, or if you wear your hair off. Boop. Crow's feet, all right? It's very interesting to me. Half of women say, I earned these crow's feet and I love them, and the other half hate them. Okay? When they get very prominent and they're kind of distracting and they look like radial lines emanating from your eyes, they can be, distracting. Okay, so we talked about overactive muscles. Now let's talk about loss of volume. All right, this is a before and after. It's snuck in here, okay? So this person wanted to see improvement in their nasolabial lines or the parentheses around the mouth. Just took a little bit of filler. Here's another loss of volume that we see a lot of. We would call this runner's face. Catherine Deneuve said, at 40, a woman has to decide. Is she going to concentrate on her face or her fanny? Weight loss is great for your fanny and terrible for your face, okay? When you lose weight, or if you're very athletic, you get faces like this, very thin, loss of volume in the temples, around the mouth. Look at the hollows here, the hollow under the eyes, and she probably looks 10 years younger than she actually is. Another runner's face, the hollowed cheeks, look at the mouth, okay, her lips are thin, she has hollowing of her temples. Here's some more loss of volume and lipstick lines. If you smoke, they're called smoker's lines. If you don't smoke, they're lipstick lines, okay? You can see she has a little jowling going on. These are called marionette lines. Here are the lipstick lines, here are nasolabials, and of course, this whole thing makes her look a lot older than she probably is. Here's some lips. I love to improve lips. It's very satisfying, and we're going to do a demonstration on somebody's lips tonight, I hope. Okay. So this is a very common thing. So, number one cause of aging is complexion. Number two cause of aging is are wrinkles, two kinds of wrinkles, when you frown, lift, smile, and from loss of volume. And the third part of aging is gravity, sagging. Everything heads south. Brows, cheeks, jowls, neck, breasts, and butt. Okay? So here's some examples of descent or gravity. This young woman has her cheek pad has descended, so she has hollowing under the eyes. She has some descent of her brow and her eyelid. I am not a veterinarian, but it's the turkey neck. Everybody wants this. Okay, just take your hands and do this. I want this gone. All right, I want this gone. All right, and we have a very nice treatment to help turkey necks, which Kathy will be demonstrating, I think. Kathy or Courtney will be demonstrating it. All right. So that's it for sagging and gravity. We have a lot more to talk about here. So now we've talked about the problems, the three basic problems. Now we're going to talk about solutions. Okay, remember, problem, agitate, solution. So hopefully I've made you feel really bad about yourselves. I'm kidding. But now I can point out some simple, easy things that you can do. Number one thing you can do for your complexion is change what you use at home. All right? Let me tell you a story. In the past, I used to think what you put on your face was glop. The stuff you bought at CVS was just as good as the glop that I sold you, but mine was more expensive. Okay? And then I spent some time with Dr. Obagi out in Beverly Hills about, where's Anna, 2 or 3 years ago. And I learned some of his systems and protocols. And since then, we have been able to radically transform your complexion with just what you use at home. Okay? Just what you use at home. You don't have to do a whole bunch of stuff in my office or anyone else's office. 2 minutes in the morning, minute and a half at night, you can make your skin look dramatically better. All right? And I'll show you. So we can stimulate, clarify, repair, even out your skin tones. All right? Number two, treat those precancerous spots. Okay? Not only is it important to look better to treat those AKs, but you don't want to have skin cancer on your nose. Okay? One of the major ways we treat it in my office is something called photodynamic therapy, which not only treats the precancerous spots, treats all of them, but it also gives you a very nice cosmetic treatment, okay? Don't tell your insurance company that, but they will pay for it. The number three thing is a little laser work to help with any residual browns left over, especially darker ones, and especially with reds or rosacea or spider veins or angiomas of the face, okay? Number four are peels and a CO2 or resurfacing laser for any other residual browns and can also help with melasma. Other things include microdermabrasion. You can talk to Courtney in the back about that. Laser genesis, I'll show you some of that. Acne control, extractions like I mentioned before, hair removal. I'll show you how that can help prevent that pigmentation issues, and some scar treatments. So guess what? Here's an example of a woman who just changed what she did at home. Look at all this. Okay? Look how much even her skin tones are. All right, she has a few red spots. Of course, it's not completely cleared up, but it's dramatically improved. All right, and you can do this. You can achieve these kinds of results in about 3 months at home. All right, 3 months. Here's somebody else did the same thing. Look at the difference. This is without makeup. All right, obviously this is the after. So brown or age spots in melasma, you need a better home care system, okay? Turn over the skin surface, stimulate the dermis, the skin under the surface, and shut down the pigment cells. How do we do that? We use tretinoin, which is retin A, which is vitamin A, prescription, which helps stimulate the skin, and it's actually the only topical cream that has been clinically proven to help with aging and wrinkles, bar none. And of course, there's fading agents like hydroquinone, and there's non-hydroquinone fading agents that help as well to help shut down the pigment cells, even them out. Okay? Chemical peels are also very helpful. Microdermabrasion, we talked about laser, we'll talk more about fractional. So let's talk a little bit more about those cancerous spots, okay? They look crusty, they look pinkish. People say, I've had that for several months. It's confused for dry skin. It's not dry skin. All right, 1% progress. And for every 1 on the surface, there's 10 underneath lurking, waiting to come out. All right? So, what's a great way to treat it? A great way to treat it is to treat the whole face. It's called photodynamic therapy. The medication is called Levelin. You come into the office, we paint it on your face, you sit for an hour, read Cosmo or Allure or whatever, listen to your iPad. Then you sit in front of a special light which activates the medication for 16 minutes, okay? You're going to look like a sunburn. You got to stay out of the sun for 48 hours, okay? You're going to be very red for about a week afterwards, but the results are great. And it treats at least 75% of all the AKs on your face in a single setting, all right? Other treatments, if you're going to treat the whole face, you're going to look like a very red beet for 4 to 6 weeks, okay? With this, it truncates it. It gives a much better overall global treatment. And it's covered by all medical insurances. One of the few cosmetic treatments out there, all right? So here's a before and after. These are all AKs, 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 okay? 2 days afterwards, looks like a sunburn, all right? You can go back to work. Do it on a Friday, you'll be back to work Monday, you'll be red, all right? 2 weeks later, look how he is cleared up from there, all right? So here's another solution for your complexion. These are for the reds and browns, okay? I'll tell you a little bit more about our lasers at the closer towards the end of the program, but I will tell you we do have, I'm going to boast here, the world's best fascial laser. I didn't say that, but some experts have said that about this laser. It's great for reds, it's great for rosaceas and spider veins of the legs, etc. And what you do is you trace out all these individual reds, okay? Seals them shut, can't carry blood, you can't see them anymore. Then we make the spot size bigger and we go over the whole face. We do what's called a global pass. So it reduces that overall redness. Tina, my receptionist, came to us, huge red rosy cheeks, okay? She had to wear very thick pancake makeup. Kathy, she had how many treatments? 2? She had 2 treatments and she didn't have to wear makeup anymore, okay? Now, got to do it on a Friday. Over the weekend, you're going to be red and swollen, okay? Small price to pay to look so much better. And I'll bring her up here. She doesn't want to say anything because she's shy. Here she comes. So Tina, are you wearing makeup now?
Just very little.
Very little, okay. She'll walk around with a big R sign on her head so you can talk to her, all right? But when you get close, you can see her complexion is completely evened out. If you're on our mailing letter, she was our patient of the month for the beginning of the summer, and she talks a little bit about it. And you were pretty swollen afterwards, your first treatment?
The first treatment I was.
Yeah, you were very swollen because the reds absorb heat and light and energy, so you go, and then it settles down, okay?
Yeah, because the
great.
second treatment I think well.
Right. Now, will she have to do it again? Yes, she will. This is a genetic thing, okay? So just like some are prone to brownish discoloration, other people are prone to reddish discoloration. So she'll need it in the future, okay, maybe a year or so, just as maintenance to maintain the benefit. Talk a little bit, show you two pictures of CO2 laser, okay. CO2 laser is a great laser, all right. In the past, however, it wasn't. In the past, we used to use it to take off the top layer of skin 100%. So you were very red and raw like beefsteak for a week. You hated us for 2 weeks. In 6 months, you looked fabulous. Well, a bunch of smart doctors figured out if you take that same laser beam, break it up into thousands of microscopic beams, and treat the skin, you create a little treatment zone into the skin surrounded by normal skin. You heal so much faster. And I can tell it to put in this much energy, penetrate this deeply, for the holes to be this big, for the holes to be this close. And you can say, Dr. Dohner, it's a Friday, I need to be back to work on a Monday. I can have you back to work on a Monday, all right? This is a woman who had a high energy single pass CO2, and you can see the difference, all right? If you don't think this took 15 years off of her face. Here's somebody else. This is more subtle, but it's still there. Her lipstick lines are softer. It also helped with the browns. It helps soften the lines between her eyes. Helped here too. Here's some other solutions for complexion. Remember that mole that was on the face? We have a special machine that can cut it right off, shaves it off with radio waves, okay? All right, there's no stitches involved. When you leave, you have one tiny little dot on the skin where we shaved it off, put a little bit of antibiotic ointment 3, 4, 5, 6 times a day. Now, does it look completely like the surrounding skin? No. Still looks a lot better. All right?
Can you do that to a skin tag?
Yes. Oh, yeah. We love skin tags. All right? Beauty mark, pretty big beauty mark, okay? Shaved off, you can see. And I tell people it's going to be slightly different, slightly lighter, slightly darker than the surrounding skin. It's still going to look a heck of a lot better. No scar, no stitches, no railroad tracks, okay? Here's somebody who had some scar treatments. A little bit difficult to see from the back, but you can see these are boxcar and ice pick scars. And what she had was some subcision and some what's called a cross technique to the ice pick scars. And you can see how much smoother this is, all right? Still has some of the pigmentation. We'll need some peels and change some home care, that kind of thing. So we talked about solutions for complexion problems. Now we're going to talk about solutions for wrinkle problems, all right? Remember, 2 kinds of wrinkles. The kind when you frown, lift, or smile, and the kind from loss of volume. So there's 2 different solutions. Wrinkle relaxers, okay? In the past, all we had was Botox. Botox had its 10th anniversary birthday 2 years ago. So I think it's been out for 12 years, all right? Then there was Dysport, and now there's Xeomin, and I heard that there's 2 more coming out. So are there major differences between the 3? It's Pepsi and Coke. What do you prefer? Okay. They all last approximately the same. They all kick in approximately the same. The differences are subtle. I price them all the same so that you don't have to choose on the basis and try to, save a few bucks. I can say, this is the best one for you. This is the one we're going to use. Okay. So what Botox does is puts the muscles to sleep. I should say wrinkle relaxers. Okay, puts the muscles to sleep. These are depressors. If you put these to sleep, it opens them up. It opens your eyes, all right? You don't have those deep lines. You don't look like you're squinting, frowning, etc. And I've got a poster to show you other uses as well. So let's talk about fillers briefly. These are for resting wrinkles from loss of volume. We restore the volume that's been lost, okay? You fill the balloon. Okay, so when you have a balloon that's kind of deflated and wrinkly, you don't like squeeze it out and make it smaller and stretch it. You put more air into it, okay? It's the same concept, all right? Most people who go in for facelifts, frankly, don't need facelifts, all right? Facelifts only do this. They don't give you volume. They don't restore your cheekbones. They don't help your eyelids. They don't help your brows, all right? All they do is a little bit of lift here. All right? So there's 3 major fillers that we use. Hyaluronic acids, we call them HAs. There's Juvederm, there's Juvederm Ultra Plus, there's Restylane, Perlane, Voluma, Boletero. And the differences between them are a little bit more than just subtle, okay? So hyaluronic acid, what is it? It's a clear, colorless, natural substance. It's actually found in your body, okay? So what they do, they grow it in a test tube, they mix it with Novocaine, put it in a syringe, okay? And then we inject it into the lines depending on where it's needed, okay? Hyaluronic acids are very forgiving. They're very safe. They give a very natural improvement. You can inject them very superficially right into tiny little lines, or you can inject them deeply to give yourself some volume. And Boletero, for instance, is for very fine lines. Voluma, for instance, is for very deep lines, just for cheekbones, okay? And if there's a problem with the hyaluronic acid, I can dissolve it, okay, with something called hyaluronidase. So if something happens or you have a lump, I can inject it. I've had to do that. Not for people I've injected, though, okay? Radius. Radius is calcium hydroxyapatite. It's been around for a long time as well. It's a deep filler. It's a volumizing filler. All right, you can't inject it into the lips, you can't inject it under the eyes, but you can put it anywhere else. Temples, cheekbones, nasolabial folds, marionettes. Its chief advantage is that there's a lot more volume in a syringe, so it's more economical, and it lasts somewhat longer. Hyaluronic acids, for instance, are generally going to last between 6 and 15 months. Radius will last between 12 and 18 months, okay? Now, the last filler is a special case called Sculptra. Sculptra doesn't just fill wrinkles. It actually restores your youth. It restores the contours of your face, all right? And with Sculptra, it's a stimulatory filler. And what I mean by that, it's injected, it's mixed with Novocaine, and there's a lot of volume with it. The next day, it all goes away, you say. Then you wait a week, nothing happens. You wait 2 weeks, nothing. At 4 weeks, all of a sudden, you start to see volume, all right? You start to see improvement. It needs to be repeated, all right? The average 40-year-old woman needs to do it once or twice. The average 50-year-old, 2 or 3 times. 60, older, okay? And those treatments are approximately every 4 to 6 weeks. Sculptra will give you at least 2 years, and it can be touched up. This is one of the secrets of the movie stars. Why? Because it's natural. It looks very natural. When you have it done, people aren't going to say, whoa, did you have a facelift? Okay, it's not like that at all. It's very subtle, but it's a very nice improvement. Now, there's a third kind of wrinkle, which is a very special case, smokers and tanners face. Okay? It's a special case. You have global wrinkles. You got wrinkles everywhere. Wrinkles, okay? And this requires volume and resurfacing. Remember those CO2 pictures I showed you? I'm going to show you some more then. All right? So let's talk about wrinkle relaxers. Botox, Dysport, Xeomin softens the muscles, which cause the wrinkles. Treatment literally takes 20 seconds. Women have it done. They say, is that all? Yep, that's all. Boop, 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 boop. That's it. Looks like a mosquito bite for about 30 minutes. You're a little swollen for 30 minutes, goes away. Dysport starts to work the next day. Botox takes maybe a couple days. Xeomin maybe takes a couple days. Generally used on the upper face where the muscles are, all right? So generally don't use Botox here except in special cases, which I'll show you something in a minute. So between the eyes, forehead, crow's feet. Lasts 3 to 5 months, on average 3.5 months, quick, easy, painless. So here's some befores and afters. These are the frown lines, boop. It's a very typical look. Also look and see how the brows have raised a little bit, okay? Here's a forehead. Look how nice and smooth that is. You see the big tall guy, Matthew, here? We do his forehead because he has really deep lines, because I'm a slave driver. And then here's crow's feet. This is 1 month out, all right? So other things that Botox can treat, Pete has seen this poster. I think everybody else has too, okay? So forehead lines, frown lines. We can lift your brow. It's called the Botox brow lift. Crow's feet. the bunny lines between your nose, okay? If you have a really gummy smile, you smile and you can see the gum, I can drop that by about 2 millimeters so it looks much more natural. If you have very severe lipstick lines when you purse your lips, suck on a straw, something like that, we can soften them. And if you have your lips enhanced with a hyaluronic acid filler, it makes it last longer, all right? If you have a real pebbly chin, can't see mine, we can put a little relaxer in there. Also, if you have downturned mouth, so if the corners of your mouth are downturned, you have overactive muscles right here pulling it down. We put a drop of Botox here and here, and it evens it out, okay? Neck bands, all right? Really strong neck bands, and they really bother you. Boop, 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 a little bit of Botox very nicely. Let's talk about the fillers, restoring the volume. We can use them anywhere on the face, especially under the eyes, the lips, the nasolabial, marionette lines. We're filling the balloon back up. Hyaluronic acids we talked about. They're for deep or fine wrinkles. We talked about Radiesse, and we talked about Sculptra. All right. As in everything in this world, there's the right way to do it, and there's the wrong way to do it. I see these kinds of lips when I go down to Miami, Key West. Ugh, all right? We don't make these kinds of lips, okay? They are not good for you. About 3 years ago, I had a woman come in. She was getting married for the 4th time. Should have been a tip-off to me. She brought in a Playboy picture. She wanted those lips. Didn't do it, okay? Because big lips don't look good, all right? We're not trying to draw attention to any one part of your body. We're trying to restore what you used to have, all right? Another problem, hyaluronic acid gone wrong. Look, look, look. All right? Can't just grab a syringe and do see one, do one, teach one. You got to know what you're doing here. All right? This is a bleb of a hyaluronic acid. All right? And obviously it looks bad. Guess what? Hyaluronic acids injected under the eyes can last 18 months or more. Would you want to have this for 18 months? No. Thank goodness there's hyaluronidase so we can melt this and make it go away, all right? So these are the kinds of things that I like to fix. All right, here's an example of some lips with some Restylane, all right? Nice and subtle. For you in the front row, you can see that this young person does have lipstick lines etched in, and they're very nice and soft, okay? Restoring the lips she used to have. Here's some Juvederm. The nasolabial folds, helping with the lips as well. This is probably 3 syringes here. Here's another one with, I think that was Juvederm. Here's some more with Restylane around the mouth. Very nice and soft. Hating those lines. Here's some more Juvederm. Look around the mouth. That's 3 syringes. Here's some Boletero. Boletero is the only hyaluronic acid out right now which you can inject right under the skin. In the past, we had collagen. Collagen was great, okay? You could put it right under the skin, no problems, looked really good. Guess what? It only lasted 3 months, all right? And you had to come back and do it again. Now we have Boletero, and you can work on those kinds of lines. We just raise tiny little blebs, boop, 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 smooths them out very nicely, okay? You can use this on crow's feet, between the eyes, tear troughs, if the reps put their fingers in the ears, lips. Okay, here's a volumizing filler, Voluma. This is still hyaluronic acid, all right, restoring her cheekbones. Voluma just came out several months ago. It is only indicated for right here, all right? It's a very deep, very thick filler. It's mixed with Novocaine. You get immediate improvement. Usually need a minimum of 1 syringe per side. You might need 2, 3, 4. You can always add it. Don't want to take it out, all right? And you can see the difference here, all right? How she's restored her cheekbones. New Beauty magazine, which is one of the premier beauty journals, named Axillis Skin Tightener of the Year for 2014. So I'm very happy with that. We've had it for about 18 months, and that machine is humming all day long, all right? We do something called the lunchtime facelift. We do open your eyes. We can use it anywhere in your body. Your brows, your eyes, your cheeks, your jowls, your neck. I can take, if you have an A or a B cup, we can make you more perky, all right? We can work on your bat wings and melt fat or tighten. Abdomen, if you have little mommy belly, if you have fat, we can tighten it up and melt the skin. We can do your saddlebags, we can do your inner thighs, we can do your knees, we can do the backs of your thighs. I don't think we do any ankles. And we have something called, oh yeah, the turkey neck. Remember the turkey neck? Yeah. All right, I've had it done to my turkey neck. All right, we also offer something called intimacy. Don't talk to me about it. Talk to Kathy. Enough said. All right, so we have something else besides the lunchtime facelift. It's called the liquid facelift, okay? This fills and lifts at the same time. And what we use is we use a fair amount of filler, hyaluronic acid, Radiesse, whatever it takes depending on the area, okay? And then we also have something called neotensil, which is an invisible bra for your lower lids. And we're gonna have a demo of that in about 5 minutes, okay? All right, sagging skin and wrinkles, Axillus, it tightens and contours the skin, improvements in the tone texture of the skin as well. It stimulates it, it's non-invasive, it feels like a hot stone massage. If we're really melting a lot of fat, it can be warm, okay? I've had it to my neck and I'm a baby, right? So if I can do it, you can do it. It feels like a hot stone massage. When you go over bone or very thin skin, it's a little hotter, all right? So you just lay there, all right? There's very few people who can't have it done. If you weigh more than 30, 40, 50 pounds and you want to melt some fat, it's not the thing for you. It's really not. Treatment takes anywhere between 30 and 120 minutes, depending on the area of the body. The improvements, you see about a 10% improvement, and then you continue to see improvement. How many treatments does it take? It depends on where it is, how old you are, and how much laxity you have. So it could be 2 treatments, it could be 4 to 6, all right? So, and everybody is different, all right? The other beauty of this is, unlike lasers, it is colorblind. It doesn't care what color your skin is. It doesn't matter if you've had a tan, all right? With lasers, if you're darker skin or have a tan, we have to be very careful because we can damage your skin, we can blister, we can cause permanent changes. With radio frequency, it doesn't care what color your skin is, all right? The results generally last for about 3 years. All right, sagging skin, Axillus. Here's turkey neck, a little bit of jowling, all right? Does it give you facelift-like results? The answer is no. We call it the lunchtime facelift to just give you an idea of what we're trying to achieve, okay? This is a very nice eye improvement. What we can do is just take it around your eyes, boop, 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 create some nice tightening there. Here's somebody with a neck, really defining the jawline better. And here's some bellies. So let's talk about the liquid facelift, okay? Liquid facelift is very nice. If you've got a wedding coming up in 3 weeks or you're going to a reunion, this is great, okay? This is amazing, all right? It only takes about 30 minutes. We mark you out, we figure out what you need, and we place it exactly where it belongs. When you leave, you're looking great, okay? Can you have some bruising? Yes. Will you be more swollen the next day? Yes. Do it on a Friday, take the weekend off, sit with a martini in one hand and the clicker in the other and some ice packs. You're going to be great by Monday.
How long does that last?
It depends on the filler, okay? Anytime we're doing lips, you're generally going to get 6 to 12 months. Around here, 12, sometimes 15 months. Under the eye, 18 months. Deeper injections like Voluma with hyaluronic acids are 2 years, Radiesse 18 months or more, all right? So it really depends. But, you know, in 30 minutes, every 2 years.
Part of your face will sag like 6 months or 12 months? Like
No,
berries?
no. No, because what's happening is this. We're putting the longer lasting fillers like in the cheeks and the temples. All right, because we can, because they will take it and they respond appropriately. In the lips, we can't put thick fillers like Radiesse that will cause a lump and you hope lasts 18 months. It doesn't work like that. Okay, we don't have anything that lasts that well in the lips at this time, unless you do an implant or fat. And there's lots of problems with those two things. All right? And it can be combined with Botox to lift your eyebrows and smooth the crow's feet. So here's two examples. Here's a young woman. She's about 45. Look at her cheeks. Look at her jawline. All right? Look here. Look where the light's reflecting off. And the temples. And obviously she's had some Botox too, so she's elevated her brow. So she's gotten a nice little Botox brow lift there. Here's somebody else. Look at that. Little brow elevation from some wrinkle relaxer under the eyes, here, jaw lines, temples, lips. All right? That's a single treatment. So combination treatments are where it's at. All right? So facelifts only do this. They don't work on the top of the surface of your skin, the complexion. They don't work on wrinkles. They don't work on loss of volume. So you need to work on the complexion this way. You need to work on wrinkles this way. You need to work on sagging this way. It just is the way it is, okay? So there's a couple of combinations. Home care system, people frequently then will have some peels or some laser, some wrinkle relaxers, some fillers, some skin tightening. Real nice 1-2 punch is doing the lunchtime facelift to create some tightening and lifting, and then doing a CO2 afterwards, especially if you have a lot of browns and a lot of wrinkles. I don't know, this summer we saw so many women for weddings and reunions. Okay, I have something in 10 days, what can I do? Not a lot, all right? But you can do some wrinkle relaxers if you need a little bit of touch-up, all right? I'm not gonna treat you under the eyes because of a potential for a bruise that could last for a few days, but lips and around the mouth, very nice, minimally invasive, boom, you're better, okay? One more poster before we go into the demonstration. How many years do you want to turn back the clock? If you want to take off a year or two, frown lines, crow's feet, a little bit of relaxer, microderm, some skin care, 6 to 10 years, the same, some fillers, some laser work. If you want to take off more than 10, you got to do more intensive stuff, okay? I'm not a plastic surgeon. Don't ask me about facelifts or eye surgery or neck surgery. I can give you some very good names of people that I recommend. I find the vast majority of my patients don't want that. They don't have the time for facelift. They don't have the inclination. They're scared about potential complications. You know, they'd rather do these milder things because we all have busy lives. All right, neotensil. We've only had this in my office for about a month now. It's an invisible bra for your lower eyelids, okay? And you're saying to yourself, how the heck can that work? Well, it does, all right? What you do is you apply a polymer and something that hardens it, and it's completely invisible. One of my, I guess for lack of a better word, employees had it done on one side. I was like, whoa, you couldn't even see. And the other side, because this is the way we're doing it. So she had her right side done earlier. She had her left side done earlier. Sorry, I didn't look. Okay, now we're going to do the right. All right. You can apply this by yourself at home. All right. That's the point of all this. All right. This is for somebody who has lower lid bags, drooping. They're not ready for eyelid surgery. Maybe they have too much skin there. Injecting some filler won't help. Maybe they haven't responded well to Exilis, that kind of thing. So you can put it on before a big event, tightens it up, pulls it back, and it's good till the next day, all right? It's painless, no allergies to speak of, comes as a kit. We teach you how to do it, all right? So it's a really nice thing. Is it temporary? Sure it is, all right? But it works really nicely.
On this product?
Yes.
The cost on this product?
$4.99 for the box, which does 100 eyes.
Back. This is to ground the radio frequency. This is where it's going to travel through her body, right here on her back. Head up here. Oh, sorry. Yep, and I'm going to use this pillow just under your legs to make it nice and comfy if you want to. Here, lift up your legs a little. Comfy? Yeah.
Hello, how are you? 30. Yeah.
What did you want to do? I was sorry. Here's some Excelis brochures if you guys would like to look at them. Thank you. Thank you. You guys can come a little bit closer if you'd like so you can hear me talk. Some people can come around on this side of the bed if you want to.
I'm not shy. I'll stand right over here. As long as I'm not in the pictures.
Alright, so what we're doing is called the lunchtime facelift. I'm going to be putting some cold ultrasound gel on Corinne's face. What I'm doing is I'm applying radio frequency to Corinne's face. Her face is going to warm up. It's going to be a gradual heating up. The idea of Excelis is to get the heat to penetrate down into her dermis, okay? We want to kind of stimulate her existing collagen, and what that's going to do, that's going to give her a subtle improvement. It's going to help to smooth out some fine lines. It's going to help with a little bit of sagging, okay? Excelis can have anywhere from a subtle to a significant improvement. It is a cosmetic elective procedure. We cannot guarantee results. Most people will see anywhere from mild to very, very, very good improvement on their face. We have some people here in the audience who have already had this treatment done. We've had this machine for about a year and a half. We can do facial procedures, we can do eyes, we can do body parts where we do fat melting, skin tightening. We can work on your cellulite, we can do tummies, arms, inner thighs, outer thighs, love handles. We can work on the fat under your neck if you have any of that right here. So let's get started.
Can you go back to work after?
I'm sorry.
Can you go back to work after?
So Excelis has no downtime. It's not invasive. Corinne's face is going to be a little pink right now. That's going to last for up to about 24 hours at the most. She can put makeup on right after the treatment. She could go swimming. She could go tanning. She could get a facial. She could have another laser treatment. This does not affect your skin and stuff.
Is there, you see anything age-wise at certain ages, you know, with people in their 60s, it doesn't work as well, or?
So if you want to get any type of laser procedures, especially Excelis, you need to have a realistic expectation. I'm 30 years old. If I was to get Excelis, it's probably not going to do much for me. If you're 85 years old, Excelis probably isn't the best choice for you. The best candidate for Excelis on the face is probably somewhere between 35 and I'll say 60. If you are over 60 and you've got, let's say you're in decent shape, then Excelis is probably good for you. If you have very significant drooping and sagging, if you have a lot of loose skin, you don't. If you do though, Excelis is really going to be a waste of your money.
What does it usually cost, roughly?
Depends on how old you are. If you are under the age of 55, we recommend 2 treatments. That's going to be $1,500. If you are over the age of 55, we recommend 3 treatments. That's going to be $2,250.
Now you call it a lunchtime facelift?
That's correct.
How long does it take?
Well, a treatment. So it's going to take anywhere from 45 minutes to an hour and a half. Okay.
My green book.
Just no. Everyone, the amount of money that you pay is for the number of treatments that you get, not the length of time.
Yeah, thank you. Quite a lot. I don't see it. You know, in comparison. Everybody does. She's right now. She needs 3 treatments. She's just starting with the acne. She looks beautiful.
All right, Ready?
So this stimulates the skin?
This is stimulating her skin. It's going to stimulate new collagen growth, and it's going to cause her existing collagen to kind of
Jumpstart.
we want to say that we don't want to say that it grows new collagen. It causes your existing collagen to restructure itself.
Do you have any way to determine how much collagen we actually have? I mean,
Not necessarily. I can tell you that once you reach the age of 30, your skin stops reproducing at the rate that it used to. The older that you get, the more the aging process increases. That's where aging comes into. So you want to speed that process up by getting procedures like microdermabrasion, facials, Excellis. If you can speed up your skin's turnover rate, you're going to keep yourself looking younger. You can do that by getting skin rejuvenations, getting Excellis, all of the procedures that we offer. You might have. This has been on the doctors. This has been on no, you could not purchase this at home.
It was the what they have on TV.
This machine probably costs more than everyone's car. Not together, but it's more highly likely. So Corinne, how are you feeling right now? Describe to me the feeling. Okay. It feels warm and it doesn't hurt. So Corinne is taking the maximum amount of power that I can generate from this machine. Corinne is at full power right now and she's been doing fine. Almost at 4 minutes in. So most people think that this feels like a hot stone massage almost. It's very comfortable. If you have thin skin, it may feel a little warm towards the end of the treatments, but it's not painful.
Yeah, do you just do that area or do you go
No.
around
Right now, so our most popular facial Excellis treatment is called lower face and neck. What that includes is from her crow's feet on the eye all the way down to the neck. I'm going to do the neck in a moment, but I'm just doing the face because that's what a protocol is. We do a few minutes of the face, then we go on to the neck. You can get your eyes done by themselves. You could get your face done by itself, your mid-lower face. You can do the face and the neck. You can do the neck by itself. You can do them all together. We have all different types of packages and options. But this is our most popular procedure that we offer. This is not an ultrasonic machine. This is radio frequency. And Excellis has been named the #1 skin tightener of the year by New Beauty. Excellis.
you said that you can do the alleys.
Yep, so we do body parts with that large handpiece right there that you see on the right hand side of the machine. That handpiece actually tells us how hot your skin is getting. Okay, and we can penetrate down to your subcutaneous tissue, which is below the fat. We melt your fat in layers and we tighten your skin with the body handpiece. That's how the body treatments work. Even though this machine is utilizing radio frequency technology, the handpiece, we're obviously not going to melt the fat on your face. That's why we're just doing collagen stimulation, which is skin tightening essentially, with this handpiece right here. Now, the body handpiece, the treatments do get much warmer than what it feels like on the face, but the skin and the tissue, the skin on your body is much thicker, so you can handle, more heat.
And how many treatments do you do? Like, how you get
for the face, or for body treatments. So let me back up. So for the face, if Corinne was going to come in and pay for treatments, she would get. Okay, Corinne would get 2 treatments. She would be paying $1,500 for 2 treatments. If we were doing body treatments, we're going to recommend about 4. If you have severe sagging skin, if you have a lot of loose skin, we're probably going to recommend you get 2 additional treatments, which will be 6 treatments total. The package includes 4 treatments. Most of our body treatments are $1,600 for 4. You would need to pay for the additional treatments. So deemed that you needed those kind of things. Okay. So we're just going to do it.
So what happens to the fat inside when you're with the radio frequency?
So what happens is the fat cells are heated up and they are drained through your lymphatic system. It's very important that if you're getting the body treatments, that you are increasing your water intake the day of, day before, day after the treatments. We strongly recommend you to go swimming right after. With Excelis, you have no restrictions at all because it's not affecting the surface of your skin. Excelis is penetrating down underneath. Even though you feel it on your skin, it's heating up down to the dermis. It's not actually affecting your skin itself. And Corinne's skin is hardly even pink. That will go away within, and Corinne doesn't have sensitive skin anyways, but let's say that I was working on someone who was very fair. Their redness might be a little patchy and it might last for a day, day and a half at the very most. But you can put makeup on right after you get Excelis. You can do anything.
Now, what would it take 120 minutes to be successful to rebuild? What would you be doing?
So that's 120 minutes is the total amount of time that we would be in the room. I think that's where you're getting the 120 minutes from. That's not necessarily how long the treatment itself takes. That's how much time we're allocated to complete the treatment from the time we enter the room and clean up and everything. Some people...
We have 5 minutes.
Some people get a little sensitive with the Excelis, and I'll have to stop and readjust my gel. Like right now. See, Corinne has been fine. Corinne has had things done before. She's great with this. Some people, though, they might get a little sensitive. I'll have to stop, give them a breather, readjust their gel. They might have to get up to go to the bathroom, etc., etc. We have to allow ourselves enough time. So we have 30 seconds left.
Is she going to see results after this is done?
This isn't even half of the full treatment, and she would need 2 treatments total. She may see a slight improvement, but typically what we would do, we would treat one whole side of her face and neck twice, and then go over the other side. So we cause a double injury.
Okay.
Yeah. No. This is just for demonstration purposes. No, it doesn't work like that. We've only done 6 minutes total treatment on her face and neck. What we would do in a whole treatment is about 15 to 20 minutes total treatment on each side. So, and then she's going to have either 2 to 3 treatments total within 2 to 3 weeks of each other. So that's a lot of treatment time compared to just 6 minutes on one side of the face. Correct, exactly. Yeah, we'd be here for a long time if we did. She's great.
All right, so Boletero, where can it be injected? Fine lines, crow's feet between the eyes. I'm not allowed to say this if I worked for the company. Under the eyes, lips, fine lines here, okay? Okay, let's talk a little bit more about modern laser treatments. People come in all the time. Okay, can you laser this? Can you laser this? Can you laser this? I thought laser could do this. All right. Lasers can only do so much. Hammers can only do so much. Screwdrivers can only do so much. A laser is a tool that allows us to do certain things, okay? So a laser emits light, which is attracted by its wavelength to certain targets, heats them up, changes them, and we get a desired result, all right? So facial veins and rosacea. Remember those big things on the nose we saw and on the cheeks? We use the XLV and the laser Genesis, okay? At 532 and 1064 wavelengths, they're attracted specifically to certain targets, to the tiniest little red veins, to the bigger purple veins. If you have purple veins around your eyes, we can laser them shut as well. It's a very nice treatment. Brown spots and melasma. The XLV works for the brown spots. CO2, a nice light treatment, works, fractional resurfacing for the melasma if you need it, okay? Texture, fine lines, large pores and other scars, laser Genesis, and our erbium laser. Erbium is a much more superficial laser, leaves your skin feeling as smooth as glass. The laser genesis gives you kind of like a, some people call it a laser peel. Helps tighten pores, helps with fine lines, helps even out skin tones of the reds. Toenail fungus, Genesis Plus is a laser treatment for that. I'll show you more about that. Hair, the machine over here is called the Chevaux 810 nanometer diode laser. Very fast. In the past, lasers for hair removal did this. Pain in the butt. Slow as Moses. Very, very, very painful. Now, with this laser, it goes psh. Literally, you can do a whole neck in a minute, an upper lip in about 10 seconds, Matt's neck in about 1 minute, did my back in 10 minutes. So it's really fast, okay? So I just had a question. One treatment for laser hair removal? No. Why? Because laser hair removal only kills the hairs that are in active growth phase. All right? Only 10 to 15% of the hair is in active growth phase at any one time, so you need to do it more to kill the hair that's going to come out. All right? I've had 4 or 5 treatments to my neck over the past several years because I'm lazy and don't have the time, and you can probably see the difference between my 5 o'clock shadow and my neck. All right? It's very nice, and I have very high density.
Does it work on non-pigmented hair?
Good question. Laser hair removal only works on brown or black, does not work on white, gray, red, blonde hair. For that, you need medical electrolysis. Courtney, who is over here, is the one who does all of our medical electrolysis. Okay, there she is in the back. And that's done at Karma Day Spa. All right? So, if you have a predominance of dark hair, do the laser, gets it done real fast. Anything left over with electrolysis. If it's predominantly white, blonde, gray, you got to do electrolysis. Okay? You're better off. Scars. We have lots to offer for scars. Chickenpox scars, acne scars, traumatic scars, surgical scars. Unfortunately, I left out a slide of some tummy tuck scars that we've done, and acne. So let's move on. Acne, we can do the Levulin, that same treatment that you can use for precancers, also can work almost as well as Accutane. Okay? I've had daughters who've had this done. Safe. The medication attacks the sebaceous glands, the oil glands, and it shrinks them. All right? Also, with the light itself that is used to activate the Levulin, it's called Blue U. This is a great treatment for teenagers who can't be bothered to take their medication, use their creams. They come in like they're going to the tanning bed for 16 minutes, sit in front of it once or twice a week, and they leave. So we have a program set up. You don't need an appointment. You just sign up for the program. You'll walk in whenever you feel like it, do your treatment, and go home. All right? It's a very nice treatment. This is what it does. Kills the acne, shrinks the oil glands. Here's a before and after of chest. All right? And remember we talked about your décolleté? If it makes you look old, you've taken care of your face, but your chest makes you look old, you know, what's the point? Rosacea and facial veins, we talked about XLV laser and laser genesis. Reduces the WC Fields look. Benefits last for a few years with little downtime. I've also had this done. Actually, 16 years ago, the thing that got me interested in lasers was I was at a conference and had angioma lasered off the tip of my nose. I was like, I wonder if other people would be interested in that. So here's a typical nose. All right, now remember we talked about melasma, hormonal, brownish discoloration, mask of pregnancy. Here's a very typical presentation. All right, forehead around the mouth. All right, if we used a regular laser or intense pulse light machine on this, it would make it worse. It would make it darker and browner because you're only activating those pigment cells even more. So what you have to do is either home care, shut down the pigment cells, hydroquinone fading agents, tretinoin, wait a while, then you can use either a peel, which is a better choice, or CO2, depending on how recalcitrant it is. Look how she cleared up. venous micropeel. This is not really for brown spots. It's more for textural abnormalities, pore size, burning off little things. We call it the venous peel. Fractional, we talked about. I've got some good pictures here. Here's some melasma after fractional treatment. Here's some scarring. One of our very first fractional patients, I don't know, 5, 6, 7 years ago, was a young movie star locally, moved to New York City. He had a scar on his forehead. We improved it considerably. It was almost gone. Then he got in another bar fight and had another cut. All right, look at this. Remember I talked about smoker's face, tanner's face, these kinds of global lines everywhere? All right. This is a high energy CO2 resurfacing. So this is a one-time treatment, but you and I have to get to know each other really well beforehand because you're going to hate me for 1 week afterwards. You're going to be red, swollen, crusted, oozing, weeping. You won't be leaving the house. Okay? Guess what? In 2 weeks, you're going to want to have my babies. Look at this. See that? Okay, here's somebody who's obviously a lot older who also had a CO2 resurfacing. All right? Now, is this a home run? For her, it was. All right? These are softer. They're not gone, but they're softer. Okay, we talked about laser hair removal. Kills the unwanted hair follicle, produces the hair, requires 6 to 12 treatments, okay? And it depends on your end goal. If you want to have hair as smooth and as clean of hair as a baby's behind, you need more, all right? The 810 diode has just been a home run for us. I mean, it's fast, it's painless, it works, it's, you know, just, it's great. We've been able to reduce the prices because the laser is so much faster that we can, it doesn't take us 2 hours to do a set of legs. It takes us only less than an hour. It takes less than an hour. It used to take 2 hours or more. Man's back, 20 minutes, used to take forever. ND YAG laser. Now the ND YAG laser is safer for people who are what's called Fitzpatrick type 4, 5, 6. Dark Italians, Indians, Hispanic. So if you have darker skin tones, we have to be very careful. That's where we use the deeper penetrating lasers like a 1064 ND YAG. Okay? Slower, but it's much safer. Medical electrolysis, traditional method for blonde, gray, red hair. All right? So if you have blonde, gray, or red, you have to see Courtney. Right, here's an armpit.
Oh my God.
It's mine. All right. Now, remember I showed you a picture of post-inflammatory hyperpigmentation from somebody who was plucking. Caused some brownish discoloration, caused inflammation, caused swelling, textural changes. Look at the difference, how that cleared up because she stopped plucking because of the hair being killed. All right? So that's a very nice side benefit. Stretch marks, we're not even going to talk about it. Stretch marks are tough, all right? Now, if you have a red or purple stretch mark or scar, like a tummy tuck scar, or if you've just had a baby and the stretch marks are purple, we can improve those very rapidly, very easily, okay? But if you have stretch marks that have been there for years and years and years, and they're white and depressed, we call it atrophic, those are much more difficult, okay? We do have a laser specific, not specifically, but we do have a laser for that, but the results are not a home run, all right? So, and then we have other issues to deal with that, something called hyperpigmentation as well. You might have to use some fading agents, things like that. So I don't recommend it as much. Of course, that's what an old stretch marks looks like. Body issues. Okay, Exelis. We talked a little bit about this. Radio frequency can penetrate much deeper than a laser. It's colorblind, it's FDA approved, and it uses radio frequency. It doesn't use a laser. All right. Here's some befores and afters. And obviously this was melding fat. This was not tightening skin. This was melding fat on love handles. all right? Fat and cellulite, they're two different problems. We can actually do cellulite with the Xeomin machine, all right? Frankly, we don't see a lot of people, a lot of women who want cellulite taken care of because we only have like 2 weeks of summer here. And, you know, I'm sure it'd be different if we're in San Diego or Miami, something like that. We do have something, another treatment for fat as well. If you have more fat than the Xeomin can help, or if there's other issues going on, we can inject that fat, kill the cells, your body reabsorbs them, and it shrinks, okay? Used to be called mesotherapy, injection lipolysis. We use some medications, deoxycholate, which is a bile salt, and lecithin, which is just a fat soybean product. It's mixed together with a little bit of Novocaine injected into the fat, tiny little insulin-like needles. You're red, you're swollen, you might be a little bruised for up to a week, and then it starts to shrink. And you see great results in 2 months, okay? It doesn't work immediately overnight. I have seen such dramatic results. Love handles, abdomens, thighs, saddlebags, etc. And it can frequently only be a single treatment. Single treatment. But we tell people, be prepared to do it 3 times, okay? All of the fat melding, fat dissolving are inches reduction. You don't really lose weight, okay? You lose inches, not weight. Are we getting people ready? Good. All right. We have, we're going to be doing some demonstrations here in about 5 or 6 minutes. Excess sweating, we've been doing Botox, using Botox to treat hyperhidrosis or excess sweating for years now. It's amazing. I just saw somebody the other day, he was an educator. He would go through 3 or 4 shirts a day, couldn't wear anything dark, you know, hands can be sweaty all the time, and Botox is indicated that's what we use, all right? Shuts it down like that. And it can last 9 to 12 months. Literally takes about 5 minutes to do. Frequently, your insurance will pay for it. Toenail fungus. We have a laser specifically for toenail fungus. Heat up, kill the fungus. If you kill the fungus, hopefully the nail grows out better. There are some oral medications for onychomycosis or toenail fungus. They only work 50% of the time. They can kill your liver. You're going to be hard-pressed anymore to find a physician to actually prescribe it, okay? The laser's non-invasive. It's not covered by insurance. It doesn't hurt, but it is hot, all right? It's for milder cases of toenail fungus. If you've got big, gnarly nails the size of, you know, chestnuts, don't come in, all right? And the treatment is you come in every couple of months for 4 months, and about 80% of people respond. You see clearing. It's difficult to get complete cure. You tend to get it back. There seems to be a genetic deficiency that causes people to get this, all right? Here's some befores and afters. All right, so let's talk about leg veins, all right? I know just by statistics that 1/3 of all of you in this room have varicose veins, all right? Why? Because 1/3 of all women have varicose veins. Why? Because of genetics, having babies, being on your feet, hormones, and bad luck. Why are varicose veins important? They're an important cause that's little known though. Pain, aching, tired legs, heavy legs, cramping, nighttime leg cramps. We can cure nighttime leg cramps. Restless leg syndrome, all right, swelling, rashes, itching, scarring, ulcers, clots. Varicose veins cause all of these things, all right? This is a very satisfying part of my practice because I make people feel so much better, okay? So what happens? Your veins dilate underneath the skin, the valves fail, so the blood leaks back down the legs, everything's under high pressure. It leads to the symptoms I just talked about and inflammation of the skin. So how do you diagnose it? Well, we can look at your legs and say, yep, you got veins, but we don't know where they're coming from. So we need to do an ultrasound, and you have to be standing up for the ultrasound to actually tell us what's happening, okay? Ultrasounds are painless. Warm gel, We're gabbing the whole time. You got a TV to watch, okay? It's no big deal. And the treatments are covered by all insurances. I don't know of a single a single insurance that does not cover varicose veins, all right? So how do you treat them? Well, there's three things. You cannot fix the veins or fix the valves. The only thing you can do is either seal the veins shut, causing the problem, or removing them. Well, in the old days, they took you to the operating room, put you to sleep, shoved the tube down your throat, cut your groins, stuck wires down, big cuts on the legs, and you'd lose 6 weeks of your life. You don't have to do that anymore, okay? It's a piece of cake. What you do is you come into the office, everything is done under local anesthesia, you get a tranquilizer if you want it. It's like starting an IV in the vein, okay? So we start an IV in the vein that's causing the problems, we feed a little tiny laser fiber inside of it, numb it all up with Novocaine, fire the laser, boom, you're done. I can do it in 18 minutes. I did 2 this morning, all right? And your legs start to feel better almost instantly. If you have big ropey veins on the surface, we mark them out, we numb them up, we make little pokes in the skin and remove them. So tiny little poke marks on the skin, size of a freckle. You don't have the old-fashioned big railroad tracks, all right? And if there's anything left behind, we can inject those veins with sclerotherapy, okay? And you know, it's a very technical thing, but it's a very nice, elegant for veins that you can't laser and veins that you can't remove, okay? All of this is covered by insurance. Your legs feel better. Here's a before and after. This is about 2 weeks. You can see the little poke marks on the leg where we remove those big bulgy guys. Another one. All right, so those are the medical veins, the varicose veins. There's also spider veins, okay? Spider veins are cosmetic. Now, we do know spider veins can cause burning and itching, but you're never going to get your insurance company to pay for it. Ever, period. Don't even ask. It's not going to happen, okay? It's considered cosmetic, all right? So spider veins, you know what they look like. They can be blue, they can be red, they can actually be slightly dilated on the skin. So how do we treat them? 95% of the time we inject it with medication. We don't use the hypertonic or salt water anymore, okay? That caused ulcers, it caused burning and cramping, it was painful. We use an FDA-approved product called a sclera, which is polydecanol. It's the most widely used substance in the world, all right? And what it does is it irritates the inside of the vein, it seals shut, can't carry blood, you can't see it anymore. You walk in, you have your treatment, you do need to wear compression hose afterwards, and you walk out. There's no downtime. We do have a laser for spider veins, but the problem with them, with the laser, is it's much more uncomfortable. It takes much longer. It's really for the tiny little red ones. It's not for the bigger ones. It takes longer. It's more expensive, okay? So I can treat your whole leg with sclerotherapy in about 15 minutes. Treating a whole leg with the laser would take
An hour, 3 times.
Yeah, okay. So here are some befores and afters. This is behind the knee. This is tougher to see. Here's more. You can see these bigger blue veins tend to have a little bit of a brownish discoloration called hyperpigmentation for a few months afterwards. That dissipates. Here's an even worse leg. All right. And you can see that leg got cleaned up of all the darker blue veins, the bigger blue veins, and the red ones. All right. Now, I can't make your legs look like you're 21 again. All right. Or 22, or 23, or 24, unless you're 25. But I can improve them by 70 to 80%, which is pretty darn good. All right. The veins we get rid of do not come back. However, you may grow more in the future. So you may be back in a couple years for a touch-up, all right? It is what it is. All right, so now we're going to do some demonstrations. This young lady came to me about 5 or 6 years ago, covered in those brown seborrheic keratosis that you saw, okay? Her skin is amazing now. It wasn't at one time. I mean, I wish I had your before pictures because she now looks fabulous. So what we're going to do is we're going to take a little Botox, big smile, and she has a little bit of crow's feet going on here, a little bit here. So we're going to put, and oh, the bunny nose. See the bunny nose? When she squints, okay? But in women, we call it wolf nose, okay? Women don't like bunnies. Men don't like bunnies. Women don't like wolves, so, okay, so it's a wolf nose. All right, here we go. We'll do the right side first. There we go. Ooh, I like this position. This is nice. Big smile. Good, let go. All right. Pinch. Raises a tiny little bleb. Looks like a mosquito bite. Notice how loudly she's screaming because it hurts so much. Okay. She's great. Good. Here we go. She has a big fat blue vein there I gotta stay away from. Good. Now we'll do that bunny nose. Good, let go. It's a very superficial injection, right underneath the skin. And we're done. It would have taken 1/3 that time in the office. So that's it. So this is going to start to kick in a day or so. The muscles go to sleep. They smooth out. Good. We're done. Questions?
Was it topical anesthetic or?
Nope.
Nope. Is there anything in the medication itself?
Nope. We use a lot of ice, chilling the skin. And something else that's very nice is if you eat an Italian ice or an ice cream beforehand, it chills all the face, helps reduce pain, also reduces bruising, if anything happens, but it doesn't happen with this. Yeah, you do that. I'll do the Ultra Plus. Okay, we're going to use Juvederm Ultra Plus, hyaluronic acid mixed with Novocaine, clear colorless, all natural filler, made by taking prisoners, dissolving them in acid. No, 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 no. Grown in a test tube. Okay. Nasty little speaker. It's injected with a really tiny needle about the size of an insulin needle. I'm using a lot of cannulas, which are blunt needles in the office now. Reduces discomfort, potential bruising, things like that. I'm not doing it here just because it's too difficult. Okay, alcohol. She's like, alcohol. She's done. Okay, she's done. She's ready. Here we go. All right. Here we go. Pinch. Good. Look at that. Pop that right out nicely. Actually, I'll do one side and then do the other. Here's a pinch. Yeah, but I'll go around. Kathy, come to the top up here. Good. Put a little bit more in deep. Your upper lip is going to be numb. Yeah, good. All right. I'm going to change needles. Can we see? front row can see this. Some much nicer definition, really helped with that transition here versus over here. She has some nice fullness, some nice smoothing. We don't want to completely smooth out that line, okay? Because then you kind of look like a snotty dog, all right? You need to have a little bit of definition there, all right? But you don't want to have as deep a definition as you did before. All right, I'm going to come behind you, Kathy. Here we go. Good. I can't. Nope. Good. I got it. Good. Good. A little bit more. A little bit under this guy. Good. All right. Good. Thank you. Kathy, take that. I'm sorry?
No. Is it possible error to make them uneven?
Sure you can. All right. Nobody is perfectly symmetrical. Even you two are not perfectly symmetrical. So you just have to work with that. You want to try to make it less noticeable if there's a lot of asymmetry. And yeah, it's possible if you don't know what you're doing.
That's why you come to him.
Okay. All right, we're going to take this. All right. We're going to do another wrinkle relaxer here. Yes? The way the wrinkle fillers are supplied to me is in a syringe, okay? So that's how I have to dispense it to you, so to speak, okay? I price all of the hyaluronic acids except for Voluma the same because they're all approximately the same price to me. And it just simplifies things and allows the decision to be easier. The first syringe is $600. All subsequent syringes are $500, okay? Radiesse is, you get 50% more in a syringe, so I price it at $700, okay? Voluma lasts a good 2 years, and it's specifically for cheekbones, so that's also priced at $700. Mm-hmm.
What about Juvederm?
Same thing.
600.
Juvederm Ultra Plus, Boletero, Perlane, Restylane are all... Ultra Plus, which I use for her, is for deeper injections. Ultra is for more shallow injections. You did. Whoa, hello.
How are you?
Good. What are we doing?
Yeah, Botox around.
Nobody needs it between the eyes.
Well, I could.
Whoa, look at that. Oh. Okay, let's do some whatever we have. We have both? This is driving me nuts. Help me.
What do you want this?
What's this? Botox? Okay. Well.
And with her, it's prevention. Prevent those lines.
Yeah. All right. So this young lady, look at her lines between her eyes. Frown. Look at that. Okay? So she looks happy, mean, tired. All she's doing is thinking, All right. So what we're going to do is we're going to put those muscles to sleep here. And put your head back. There you go. Frown for me. Let go. Here's a pinch. Good. Pinch. Good. Pinch. Good. All right. Easy peasy. Botox. Oh. Yeah. And this is also going to give her some elevation of her brow as well. Okay? Give her a nice little rise there. Big smile. You don't need it there. You don't need it there. She wants to have it for her crows, but I'm going to tell you, she really doesn't need it.
I agree.
Yeah. We could give it to some other deserving person. All right. Yeah, we're not going to do here. There's nothing there. There's nothing there. Okay, you got this. All right. Be gone with ye. Lips are different. This is why we like to kiss, okay? They're very sensitive. So I will almost always put in a block, okay, like when you go to the dentist, but it's just a little bit of Novocaine on the inside. It numbs up the nerves, all right? It only lasts about an hour. It's very effective, and you're not a drooling fool forever. You don't need cheeks done.
That's what they said.
Cheekbones? No.
No cheekbones.
Got runner's face.
Well, okay, but okay. If we're doing that, are we going to block your lips?
You're the boss.
Okay.
What am I getting?
Novocaine. And then Juvederm or Boletero. Okay. Let's see here. All right. Okay. Lisa, all right. She has some fine lines on the upper and the lower. She's lost some volume, especially of the lower. She's lost a little bit of definition here. So I am going to put in a block, and then we're going to just put in a little bit of Juvederm, okay? With lips, what we're trying to do is give you back your lip roll, that nice definition between the white and the red. You're trying to help improve the landmarks, the little philtrum, and the vertical lines. The lower lip has to be treated the same as the upper lip, okay? The lower lip is supposed to be 30% bigger, taller than the upper lip. So if you only treat the upper lip, it looks like Daffy Duck. We don't make ducks, all right? No matter how much you beg or plead. So we're going to put in some block here.
Yeah, sis.
Yeah.
It's gonna look great tomorrow.
It's going to be red and swollen.
Oh.
Let's do your Botox right here.
Okay.
Okay. We're not doing her lips because she has to teach tomorrow.
We have a lips after this.
We have lips after this.
Airbag went off my car.
There you go. Yeah. Okay, we're going to do her crow's feet. Big smile for everybody. There. Okay, so we're going to really help with these. All right, pinch. Forgot about teaching tomorrow.
Yeah, why didn't you tell me that?
She didn't think about it.
We were thinking this temples and cheek area one person.
Oh. Turn. Big smile. Let go. Good. All right.
Can you do this one?
It's gonna hurt like crazy.
That's okay.
No, it's not. It's gonna hurt like crazy. Mid cheek, right here. Okay. What do we have? We do? Okay, we're gonna do some Voluma for cheek enhancement, okay? What's that? Oh.
They're excited.
Oh, okay. Stand up. All right. She's lost a lot of definition in her mid-face with some flattening here, okay? With some flattening here. And I can see it better from the side. So what I'm going to do is give her right in here where the light is supposed to reflect off. All right? Obviously, it's not going to look this big. Obviously, it's not going to look that big. Okay? So this is hyaluronic acid. It's mixed with Novocaine. It's a deep injection. She's going to be somewhat more swollen than she normally would be for about a couple of weeks. But it's going to be a very nice improvement, and it's going to last a couple years, okay?
What? Sometimes you can hear it. It's okay.
I don't like how this... There. Good. All right. Now, hold over there, Kathy. She needs it right here. Yep, same spots. Right here. There we go. Now that was one syringe. In a couple of weeks, she'll probably need a second syringe, okay? The results, because she didn't need a huge amount, but she had some flattening, the results are not this huge home run dramatic, okay? But that's not what we're looking for. We're looking just to enhance them, create some elevation, and you can see how easy that was. How much did you scream?
Oh, I forgot to.
Okay, good. All right.
I'm Bonnie Scott from Cooperstown, New York, and I came here tonight to see Dr. Dohner's products and demonstrations and what he could do for me. I just turned 56, so I felt I needed something, but I didn't want invasive surgery. So I was very pleased with what I learned, and then I won the $1,000 grand prize makeover, and I'm very excited to see what will happen with that.